It's actually very low. It's been suggested as being, depending on the reporting, from 8% to something like 30%. I've got to say, even say 10 years ago, I was describing compliance levels to patients as something like 30%. And then with all of the advances in mask comfort, mask design for comfort, with surgical silicone, ultra soft fabrics, even with all the advances in the last 10 years in mask design and comfort, it still looks like around 30%. So 70% of people prescribed CPAP who are not using it. And apparently it's something like 8% give up after the first night, and then 50% give up after the first year of use, if they've managed. And this is really interesting for us in terms of habit formation, because we would have thought that once you've been wearing something for, getting towards a year, that you've truly, cemented the habit. That you couldn't live without it, surely. But even then, it shows how fragile habits can be as well.
I mean, that's clearly a question of degree and impact, because for those that swear by it, there are patients that swear, I couldn't possibly live without my CPAP. They are being actually quite literal. They may well not live without their CPAP. That's how serious it could be. So for them, it's a no-brainer.
Yeah.
But I guess where it's mildly impacting and you kind of think, how big a problem is this? Is this that big a problem? But, that's part of the process, isn't it?
Yeah. Well, there are people with severe sleep apnea who are non-compliant though too. And they know this and they feel a great deal of shame about it. But at the same time, they'll just say it's just an impasse. Like they'll even use the word impossible, right? This is, I cannot do it. I cannot wear that thing. And, for reasons of claustrophobia, it might just, it's rarely at that point just for mask fit. Most of these people would have gone through a series of masks. They could have gone through 4 or 5 different masks to find the right fit, but none of them will be found, sufficiently comfortable to allow them to accept that positive airway pressure. It just feels too aversive. And so people have this belief that I cannot defocus from this. I cannot take my attention off it. And therefore, I'm going to be awake all night. It's going to stop me from sleeping. So you can see how it immediately worsens insomnia if the person had pre-existing insomnia, but also sensory sensitivities.
They would need a psychologist, Rose, I'm guessing, to help them reframe the way they see their experience.
Well, let's just say right from the outset that everyone has to habituate to CPAP. It's normal to have difficulties at first and struggle with CPAP. I can't recall any of my COMISA, co-occurring insomnia and the OSA patients who have not had some sort of, maybe days, but they still had to struggle with it. And maybe it took them the first week to really desensitize to it so that they felt comfortable. But I can say that, one of the best ways I've heard it said was from a medical student I was once supervising in a hospital setting who, because of the shape of his jaw, he needed CPAP. And he said he was finding it, again, so difficult because it felt like he couldn't breathe out against the positive airway pressure, and that he felt, ironically, and he said, I know this doesn't make sense, but it feels like I'm asphyxiating. It feels like I cannot get enough air.
Well, I wonder whether, my background is in oral health, in dentistry, and I wonder whether a mask that's not well-fitting or too tight can be pushing a jaw back and literally obstructing the airway, paradoxically.
So that's a really interesting one. And I think this is why dentists have been at the forefront of looking at the greater rates of usage of mandibular advancement splints and saying, look, with such low rates of compliance, like 30% or less with CPAP, why don't we try people with mandibular advancement? So even if it's a bit less effective than CPAP, at least it draws the airway or jaw forward and the airway open enough to keep the air flowing during the night. And so surely that's better than nothing. Surely it's better than, people struggling with CPAP.